My name is John Taliaferro. I'm an orthopedic surgeon specializing in adult reconstruction and sports medicine with EmergeOrtho here in Wilson, North Carolina. Viscosupplementation or gel injections, the active ingredient really is hyaluronic acid, and the theory behind this is really trying to reconstitute not only the synovial fluid within the joint, but almost act as a cushioning agent within the joint to help with pain and discomfort. Usually it's a series of 3 injections that will give the patient over the course of several weeks, trying to improve their pain over the course of time. And this is a way that we can not only achieve short-term pain control, but in some studies even longer-term pain control out to 6+ months. Platelet-Rich Plasma is really a new item that we've been using to help control patients' pain. It was really taken from the sports medicine world, using for things like tendinopathy, such as rotator cuff tendinitis, patellar tendinitis, or even tennis elbow. And that's really been pushed forward in terms of pain control. And the idea behind that is really we're borrowing the patient's normal immune system to help try to heal them. Initially, the thoughts were for regenerative medicine, and while that hasn't really fully been borne out, it has been shown in early studies to have an amazing man-made anti-inflammatory effect for patients. In certain situations where a patient either is not willing to move forward with surgery or has had failed with conservative management, that's a really useful tool for us in our bag to help the patient pain in their care. We're fortunate here in Wilson, North Carolina to have physical therapy right next door, and we're fortunate enough to be able to work very closely with our physical therapists, not only to guide initial therapy plans, but also long-term plans. So as a patient is recovering early from initially after surgery, trying to get the swelling down, get them walking again, and also to achieve this final few degrees of range of motion and kind of get them back to life again. We're fortunate enough to have an amazing staff here. Outpatient total joint arthroplasty has really been a new innovation, a new push over recent years in total joints specifically. If a patient's medical history is amenable to it, we are now doing many more what we call same-day or outpatient joint procedures. And those patients would be amenable to it, obviously have not only good family support at home, but also motivated to do so. If they kind of hit that criteria, we're actually allowing patients to go home same day after surgery. And this benefits the patient because we get them sort of out of the acute hospital setting, let them get home, but also letting them start outpatient physical therapy very quickly. And it's leading to not only better outcomes in terms of range of motion, pain scores, but also we're removing the patient from a hospital setting. The patient's otherwise healthy. Patients can be at home with family and support, and it gets them out of having to be an inpatient, which for many patients is a more comfortable experience and a better experience overall after their surgery. Fluoroscopy is intraoperative x-rays. So during the procedure with direct anterior hip, we're able to actually bring in an x-ray arm to take live images of not only the patient's pelvis, but also where our implants are going, and allowing us to make the appropriate decision on implant positioning and making sure we leave the operating room with a good and stable hip for that patient so they can immediately recover right after surgery.